Hi, I'm Dr. Barbara Walsh. I'm one of the physician case managers at Advanced Medical. One of my clients came to me and he was having a significant issue with what we call weakness, numbness, neurologic deficits. He had had a sudden event while he was driving his truck where he had compression of his spinal cord. He ended up being flown to a specialty hospital that had emergency surgery to decompress the area. After his recovery, he really wasn't back to baseline. His entire life was being a truck driver. And with this injury, he was no longer able to stay in his profession. And it was really something that was important to him, and his quality of life was diminished. He was weak. He wasn't able to walk well. He didn't have balance. He had ongoing chronic pain. He had multiple evaluations by neurosurgeons post-op, neurologists, special testing. Everybody said to him, this is as good as it's going to get. You're not going to be able to go back to work as a truck driver. You're going to have some level of chronic pain, and we recommend you go to a pain specialist. He ended up giving us a call. I talked to him at length about his symptoms, really what he was looking for, what his hopes were in terms of looking at function and quality of life going forward. All he wanted to do was get back to driving his truck. So we did a case summary with him. We reached out to two experts in the field, one of them at the Northern California Spine Institute, the other at Washington University. And they both took a very careful look at his scans. They took a careful look at his physical exam findings in the case. And they actually made some very sincere recommendations. They knew people in the field that would be able to perform a surgery that had at least a 50% chance of getting him back to the quality of life he wanted. Obviously, no guarantees, but they really felt that they would be able to connect him with someone who could make a difference for him. There were a couple tests they felt he should have, and when he and I discussed the case, he was thrilled. I can't even tell you how thrilled he was. All he kept saying was, I think I'm going to be able to get back and drive my truck. And we were able to connect him with the right people in his area. He lived alone. He really didn't have a support system. But the two experts were able to reach out to their own colleagues in an area that was geographically okay for him and helped facilitate him having a procedure that would make a difference. He has subsequently followed up with me on numerous occasions to reach out and say, hey, Dr. Walsh, I'm doing great. I have my life back. I can walk. My pain is resolved. You guys totally fixed me. He could not be more grateful after being dismissed by others, saying there's nothing we can do for you, go take some pills. And now he's back driving his truck and he's doing exactly what he wants to be doing.